available for you that you can and should to help you implementing this regulation. There's already a consolidated version of the regulations. There's a guidance, the template to report benefit risk and signals, and the ministerial concession that is being granted. We heard what you were saying. Industry was requesting time to implement this regulation, and 3 years to achieve full completion has been granted from the minister. There's activities that we need to prove that you are achieving for this concession to be maintained during those 3 years, and we hope we can help you to reach those milestones. As I say, 3 years have been approved, and during those 3 years, we hope we can help you implement all the different changes. There'll be quarterly workshops up until 2026. In the meantime, you can obviously contact the team for individual questions, problems, and we are here to help you. So I'm gonna give time to Nicole to prepare for the next presentation, and in the meantime, please keep sending questions to that Slido, and thank you very much.
Thank you, Blanca. Just share. Okay, hopefully everyone can see that. Okay. So good morning, everyone. I'm Nicole, one of the pharmacovigilance assessors at the VMD. First, I'm going to give you an overview of the main changes implemented due to the amended VMRs. So the four main changes are submission of benefit risk reports instead of PSURs, submission of those signals which may alter the benefit risk balance throughout the year, submission of all non-serious and serious GB and NI cases, and at a later date, third country cases, and transition from DDPS to PSMF. So I'm going to start with the bulk of the changes which affect the signal management process. MAHs should continuously monitor the benefit risk balance of their VMPs via a documented signal management process and submit these results to the VMD via a benefit risk report and signal notifications. Just before we start to get into the details of that process, just to talk about the validity of a signal. So we know throughout human and veterinary pharmacovigilance, there are some differences in the interpretation of what a valid signal is. So firstly, our working definition of a veterinary adverse event signal is information that arises from one or more sources, which may suggest a new potentially causal association or a new aspect of a known association between an adverse event or set of related events and one or more veterinary medicinal products or active substances. For our purposes, a signal is considered valid if the following apply. So there's a temporal association. The event must have occurred after exposure to the product, and it's not based on duplicate reports. A signal would be considered non-valid if it is already present in the product literature, unless the signal highlights an additional aspect of a current association that may warrant alteration of the wording, for instance, regarding reversibility or expected duration of an event, or to the frequency category in the product information. It would also be considered valid if it involves a medically important term, but limited assessment can be performed for these if that term already appears in the product literature. And again, that's mainly to determine whether there needs to be revision of the wording within that product information or to the frequency category. So we have split these validated signals into two types. Those that suggest a new risk or change to the benefit risk balance of the product or require further investigation or monitoring, and those that do not suggest a new risk or change to the benefit risk balance or require any further investigation or monitoring. Validated signals can be further defined as either urgent or standard safety signals. So urgent signals are those which require rapid implementation of risk minimization or safety measures. And standard signals would be any other validated signal that suggests a new risk or change to the benefit risk balance, or where further investigation or monitoring is required. In the majority of cases, an urgent signal will require some form of urgent safety restriction to be implemented. And these are actions that may be taken in the event of a risk to human or animal health or to the environment, and may take the form of an interim change to the product literature, or a risk management plan, batch recall, or even suspension or withdrawal of a product. So if urgent safety restrictions are proposed by an MAH, the VMD must be informed no later than the next working day from when evidence comes to the attention of the MAH for the reasons for the action. The VMD should otherwise be informed of a potentially urgent safety signal that is not deemed to require any restrictions within 3 working days of such evidence coming to the attention of the MAH to categorise it as urgent. Now, it is appreciated that a full assessment can't be performed within one working day, and also that further investigation by the MAH or VMD may ultimately conclude that the initial assessment of the signal or the impact means that no further action is actually required. So for the initial day 1 notification, we therefore only require, within the evaluation and summary findings of the BRR signal notification template, brief clinical details, an initial assessment of the urgency, and an initial assessment of the potential impact of the signal. And then any emerging information following this initial notification should be promptly provided to the VMD as and when it becomes available. Standard safety signals include any other, so non-urgent validated signals suggesting a new risk or change to the benefit risk balance, or where further investigation or monitoring is required. These should be reported within 30 days. The 30-day period starts upon conclusion of an initial internal signal management process, or once a valid signal is identified that suggests this change to the benefit risk balance, or where it's clear that further investigation or monitoring will be required for a period of time. For some MAHs, the entire signal management process will have concluded at the point of submission, but it is appreciated that there is variation across signal management processes carried out by MAHs, and it may take some time to complete signal analysis to this level. So for the purposes of compliance, at the very least, a concerted effort by the MAH to procure and assess as much information as possible within this time period must be proven. And if the 30-day timeline is not expected to be met, a communication including justification for the delay must be provided to the VMD in order for a new timeline to be mutually agreed as appropriate. Other validated signals that don't suggest a new risk or change the benefit risk balance of the product, and where no further investigation or monitoring is required, should be reported to the VMD annually, and that's as part of your benefit risk report submission. This also includes all medically important term signals, even if these have been refuted. So we've included a flowchart covering this signal management workflow within the guidance. All signal notifications and benefit risk report submissions should utilise the same benefit risk signal notification Excel template. It is very important that the template remains in its original format for submission, and only the options available in the drop-down menus or as listed in the guidance should be used, as the data in these cells will be automatically mapped at the VMD side. Dates must also be entered in the format within the guidance. There are differences in the cells to be completed for each type of submission, and we will go through that in more detail later. All submissions should be made via VMDS secure messaging, and the appropriate group should be selected depending on the submission. So for signals, you would select PHV signals for standard signals and PHV urgent safety signals for urgent signals. A separate signal notification document must be provided per signal and per MA number, or if you're using a product group code, per product group code. And again, we'll go into more detail later about the product group code. Any other valid signals that haven't previously been submitted to the VMD during the reporting period should be submitted as part of the annual BRR. If they've been previously submitted, they do not need to be resubmitted as part of the BRR. Unlike signal notifications, multiple signals can be submitted as part of one BRR. Further details on VMDS submission groups and the naming of documents for submission can be found within Guideline 4 of the guidance on gov.uk. So proposed actions need to be selected from the drop-down list on the BRR signal template when a signal notification is submitted. Additional information should also be provided within the proposed action details column. An MAH should only select other for this proposed action if no other option applies. And if a signal has been closed, for instance, if a signal process for another regulatory authority started and finished within a year, the current status should be entered as closed. The date the signal process was closed should be entered, and a final action plus details of this final action should be added. So at the bottom of this slide is an example of which cells would need to be completed for an ongoing signal or a closed signal. And we've just placed X's where other details would be provided. Again, we have provided an overview of this process, including the proposed actions within the guidance on gov.uk. So for a signal notification, only certain cells within the benefit risk statement sheet, which is the first sheet of the template, and the signals and regulatory actions sheet, the last sheet of the template, need to be completed. MAHs do not need to complete the other sheets, as these are only for use when submitting the annual BRR. The following information should be completed by MAHs in the first sheet of the BRR template. So the brand name, marketing authorization holder, marketing authorization number or product group code, depending on which one's being used, and the submission type. So for the submission type, you should select either signal notification or urgent signal notification as applicable. No cells on the benefit risk statement sheet, so this first sheet, below the submission type should be completed for a signal notification. All cells should be completed within the signals and regulatory action sheet for each signal row. If more than one species is affected by the signal, please enter the details for each species affected on a different row. Country is a non-mandatory cell, as we are aware that signals may not be country specific, but if they are country specific, then please enter that information as a 2-character country code. So the example shown here is just a small sample of the information that might be provided within each cell. We would expect further information such as incidence and extra clinical details to be included. So moving on to benefit risk reports. Following the placing of a VMP on the market in the UK, an MAH must submit a BRR once in the course of every year during the period of validity of the authorization. Ongoing, BRRs should be submitted regardless of whether the product was marketed in the UK in that year, whether there were any signals detected throughout the year, and whether the MAH deems there to be any change to the benefit risk balance or not. BRRs should cover the period of time since the DLP in the preceding BRR, or for the first submission of a BRR, that would be the DLP in the final PSUR. And there should be no gaps in or any overlapping of data. The data lock point should be no earlier than 2 months prior to the submission date. This has been altered from 60 days to allow for 2 full calendar months. Exceptions to this may be made, but only after discussion and confirmation with the VMD. So BRRs should be submitted no later than the applicable submission due date for the product to align with the annual statement submission dates on the EMA website. One completed Excel BRR template should be submitted per MA number or product group code, again, depending on which one's being used. And it is very important that the template format remains when submitted to allow correct mapping, just as for signal notifications. Submissions should again be made via VMDS secure messaging, but this time the BRR submission group should be selected. Multiple BRR template documents can be submitted per VMDS secure messaging submission. And if the VMD requests further information or the MAH wishes to submit further documentation, such as a detailed dose factor justification that is too lengthy to fit within the BRR template, or any graphs or tables, then these can be added to the submission as separate documents. The benefit risk report should either be submitted including sales data and worldwide authorization status information as one complete document annually, or can be split into multiple submissions. If multiple submissions are submitted at different time points, one must contain at a minimum the benefit risk statement and signals, if any have been detected during the reporting period, otherwise just the benefit risk statement itself. And this submission must be reported within 2 months of and no later than the appropriate submission date. Again, unless an exception has been agreed with the VMD in advance. The remaining submissions must contain the sales data and worldwide authorization status between them and must be received at least once annually. Multiple sales data submissions can be made throughout the year, as long as there are no gaps in data. To explain that a bit further, the benefit risk statement and signals and regulatory actions must be submitted together once a year. And then you can choose to submit a full year's sales data at the same time, or you could choose to provide the sales data split into a maximum of 12 separate submissions throughout the year. The worldwide authorization status data can be submitted alongside the benefit risk statement and signals, or that can be submitted at any other time during the year. And on this slide, you can see how the various different options for split submissions may work. So the grouped sheets would be submitted at the same time, and then you could submit the other ones at different time points throughout the year. Regardless of the option chosen, at the time of BRR submission, up-to-date worldwide authorization and adverse event data must have been submitted. And sales data must have been submitted at least up to the end of the previous calendar year. Although if more recent data is available, this would be preferred. If you would like to use a product group code for any submissions, we ask that this is organised at least 1 month prior to submitting the first submission of any kind. So any submission, be it benefit risk statement, signals, worldwide authorization status, or any sales, if you're going to submit using a product group code, then we ask that this is organised beforehand. For the benefit risk annual submission, the benefit risk statement sheet and signals and regulatory actions sheet should be completed, unless of course you're submitting your annual sales and worldwide authorization status data at the same time, in which case these sheets will also be completed. All cells on the first sheet of the BRR template, the benefit risk statement, should be completed for a BRR. Please ensure either a single MA number, if you are submitting the BRR per MA, or the pre-arranged product group code is used. Again, ensure dates are entered in the format shown and detailed within the guidance. If yes is answered for have there been any validated signals during the reporting period, then ensure any signals that haven't been previously submitted via a signal notification are included within the signals and regulatory action sheet. And again, as for signal notifications, all cells should be completed within the signals and regulatory action sheet for each signal row. There should be one row per preferred term or non-VEDRA term if there's no suitable PT. And multiple signals can be included per BRR. If more than one species is affected by a signal, please enter the details for each species affected on a different row. And again, as for signal notifications, country is a non-mandatory cell, as we are aware that signals may not be country specific. The third sheet of the BRR template covers the worldwide authorization status data. All cells should be completed, although whether the product is marketed at the time of the BRR submission or at the time that this worldwide authorization status submission is made is non-mandatory. But please ensure, if the information is known, that that information is completed. If you submit the worldwide authorization status data prior to your BRR submission and there is an update to the worldwide authorization status data, we request that you resubmit so that data is up to date at the BRR submission date. If the worldwide authorization status data are submitted as a standalone submission, the first sheet of the BRR template should also be completed, but only the cells down to and including submission type. And this is to allow the worldwide authorization status data to be linked to the appropriate BRR. So you must ensure the same MA number or product group code is used, as will be used for your BRR. For this type of standalone submission, you would select worldwide authorization status as the submission type. The fourth and fifth sheets of the BRR template cover the sales data. So UK and third country data.
Nicole, you're muted.
Sorry, you are muted. Yeah.
Thank you. Is that unmuted now?
Yes.
Yeah, okay. I'll start from the beginning of the slide. So the fourth and fifth sheets of the BRR template cover the sales data, UK and third country data. For the UK sales data, all cells must be completed for each row and sales must be broken down per month. If the monthly sales aren't known, an estimate should be calculated from the shortest time period available to provide the most accurate data. So, for example, if both 3 monthly and 12 monthly sales data breakdowns were available, then we ask that the 3 monthly data is divided by 3 to achieve the estimated monthly sales as accurately as possible, rather than using the 12 monthly sales data. For UK sales data, if the GB-NI split for the sales data is an estimate, please select yes for estimated GB-NI split and provide details of the split within the additional information cell. Dose factor details for which the dose factor cell can't be used, and we'll cover that in a couple of slides. And any dose factor justification should be entered within the additional information cell. The units used for the sales data should follow the options within the guidance. But if you feel none of these units are appropriate for your product, please feel free to contact us. If the sales data is submitted as a standalone submission, again, the first sheet of the BRR template would need to be completed, and only the cells down to and including the submission type. This again is to allow the sales data to be linked to the appropriate BRR and make sure the same MA number or product group code is used. For this type of submission, the submission type would be sales. If you would like to submit your sales and worldwide authorization status data at the same time, but separate from your annual benefit risk statement, then choose the submission type, sales and worldwide authorization status. So sales submissions, either as part of the annual benefit risk report or if they're submitted at a different time point, should contain one or more of the following, as long as full data for UK and third countries are received annually. So for UK sales data, all columns within the sales sheet of the BRR template should be completed per MA, per pack size, and that would be completing the cells in example 1. For EEA sales data, you can choose to either complete all columns within the sales sheet as per example 1, or you can just complete the sales volume and units as per example 2. So that means that data does not need to be provided per pack size. For EEA countries, this data must be provided per country. For non-EEA sales data, MAHs can again choose whether to use the method in example 1 or in example 2, but we ask that non-EEA data is provided grouped for all non-EEA countries together. As you can't use a 2-character country code for this, type non-EEA in place of the country code. And as a reminder, sales breakdown should be provided by month, and the units should conform to the list provided within the guidance. So product group code. For submissions that involve multiple MAs, either a product group code, PGC, must be used, or individual submissions per MA must be provided. and a PGC is strongly recommended. So the PGC links a set of MAs together into a single group and should be used to link similar UK and third country products, which meet the following criteria. They should originate from the same MAH, being responsible for pharmacovigilance of the VMPs. They should have the same active ingredients, substances. They should have the same major excipients with the same or similar pharmaceutical function. And they should have at least one common registered species. We may be able to accept groupings outside of these criteria in certain circumstances, so do contact us if you would like to propose a different group. The code must either be proposed by the MAH or a code requested by the MAH for the VMD to provide. And as I said earlier, this needs to happen at least 1 month prior to the first submission of any type using the template. So the whole annual submission or any part of that. MAHs with products that have split GB, NI, MA numbers will need to request a product group code if you want to submit one BRR to cover both, as only one MA number can be submitted per BRR. The same product group should be intended to be used for all future submissions, and the VMD must be contacted if you want to add, remove, or alter any products. The code will generally take the following format. So MAH org ID dash group name, where the MAH org ID is the alphanumeric, so 8-digit or character, organisational ID, which forms part of the worldwide case number, which is used for adverse event case submission. And the group name is an overarching name covering the products within the group. As an example, if the VMD were to have a product group code for the invented products Benefitas 10 mg and Benefitas 20 mg, with a chosen overarching product name of Benefitas, the PGC could be VMD DEFRA-Benefitas. If the MAH org ID does not clearly reflect the MAH name, for example, if it's a randomly generated ID, an alternative to the MAH org ID, which better reflects the MAH name, would be preferred. And there's a maximum character limit of 8 characters. The overarching product name might be better suited to a name referencing the active substance and formulation if there are multiple different brand names within the group. So feel free to propose the best name that you feel suited to that group. Now moving on to dose factor. A dose factor is a positive numerical value which provides an estimate of the number of treated animals using the sales data. It's equal to the average number of animals of a target population, which can be treated by one package of a given pack size of a product, regardless of the formulation. And a separate dose factor should be calculated and submitted for each marketed pack size. Now, if there is a range of species within a target population, and those species are defined, then separate dose factors per species can be listed within the additional information cell. And the dose factor cell itself can be left blank. If there is a range of species within a target population and this individual species split can't be well defined, for example, a species group of poultry that cannot be defined into separate species, an average weight should be determined based on estimated species split and on production status. A brief explanation should be provided, including the estimated percentage of each species use, if applicable. Incidence calculations. So incidence should be provided as a percentage figure within the evaluation and summary of findings cell of the template for both signals that are reported via signal notifications and for those reported via BRRs. When an adverse event signal is reported, the incidence per event term for each signal, and for BRRs this would include refuted signals within that BRR, should be provided, and an overall adverse event incidence excluding suspected lack of efficacy should be provided. If there is a lack of efficacy signal being reported, then the incidence per lack of efficacy event term for each signal should be provided. And again, that includes any refuted signals within the BRR. And also an overall lack of efficacy incidence should be provided alongside. As signals are reported per species, the incidence calculations will be species specific. But if any additional or alternative incidence information is deemed applicable to the signal, please provide it. And if it is felt that the above guidance does not apply to the individual signal that is being reported, an explanation of any alternative calculations used can be provided. Due to the requirement to comply with the amended VMRs and move on to the annual benefit risk report system, PSUR data lock points for some products may need to be revised. For products for which a closing PSUR has been received already, no DLP revisions need to be made. For products with a PSUR DLP after 17th of May 2024 and up to and including 30th of April 2025, the closing or final PSUR DLP still falls within the legislative requirements, and therefore, again, no revisions to the DLP need to be made. However, for products with a PSUR DLP after 30th of April 2025, in order to comply with the legislation, the DLPs will need to be revised. And the closing PSUR's DLP must fall prior to or on the 30th of April 2025, and the submission must be made within 2 months of that date, so by 30th of June 2025. and this applies regardless of any prior arrangements of DLPs that have been made. We ask that you accompany any closing PSURs with a covering note, which states the next cover period and the submission date for your first BRR. And all subsequent BRR submissions must be made using the benefit risk report template. And as always, there should be no gaps in or overlapping of data. If you wish to make adjustments to the DLP of a closing PSUR to align with the EMA submission date, please email us in advance and clearly state the current cover period and proposed cover period, including the submission date. If you would prefer to move directly onto the new benefit risk report template and not submit a closing PSUR, we will accept your last PSUR submission as that closing PSUR, even if the DLP fell prior to the new legislation coming into force. Please email us in advance and clearly request that the last PSUR submitted should be classed as the closing PSUR and detail the proposed cover period, including submission date for the first BRR. In exceptional circumstances, we may consider submissions outside of these requirements, and please email us with your proposal if you feel this might apply to your products. All emails in relation to this transition should be sent to psur.queries@vmd.gov.uk. We would, as always, be grateful for your acceptance of any revisions that need to be made as a result of this. So I'm now going to pass on to Maria to talk about the adverse event changes. Thank you.
Thank you, Nikki.
Sorry,
Sorry
to interrupt, Maria. Before you start, Nikki, there was a question from Simon. His hand is raised. So do you want to, are the questions being taken at the end of the presentation? If you just let us know.
I believe if it's okay, Tony, if we can wait till the end of the slides.
Sure, no problem.
That's okay, but I won't forget you.
Thank you, Nikki. I'm Maria, one of the other pharmacovigilance assessors from the team. So in relation to adverse events reporting, I'm just gonna clarify a couple of points. For UK cases, we now require all the serious and non-serious adverse events reports, including human ones, those related to transmission of infectious agents, lack of efficacy, and environmental ones, and they all need to be submitted within 30 days of becoming aware. For gateway MAHs, they are required to submit all the cases in VICH HL7 format, and they should be XML files. And for non-gateway MAHs, there are two ways in which adverse events reports can be sent to us. One is through the VMDS AER, which is the VMD reporting system, And the other way is to send them through VMDS secure messaging. This can be done until 17th May 2025. And we also be accepting EVVET XML files. Then for third country cases, those should not be submitted for now until we have all the technical systems fully developed and implemented, which is something we are expecting to work on with companies and industry. So yes, Blanca said, further meetings and discussions will be set to address this point. And then regarding those potential cases when a product has been used off-label, or those with medication and product use errors with no adverse events happening, VMD will not require MAHs to submit them, as there are no adverse events occurring. And regarding residue cases, VMD will request those where levels of VMP residues are above the permitted maximum levels, and the VMP has been used either on or off label, and when withdrawal periods have or have not been respected, and also when it is unknown if this has happened. It is mentioned on the slide as well, but in those situations in which an adverse event has occurred and the withdrawal period has been respected, we expect MAHs to perform further investigations and communicate that to the VMD. And I think that's it from me. I'm gonna now pass on to Anna.
Thank you. Oh. I think I'm sharing this in a way I wasn't expecting to. Can you see my screen?
Yes, Anna.
Lovely. Okay. Well, thank you. I'm Anna Tout and I'm the PV inspector at the VMD. Sorry, I wasn't able to introduce myself earlier. I'm having a few issues with Teams, but I'm here now. So I'm just going to talk a little bit about the change from the DDPS to the PSMF. So MAHs do have a year to make this change, and they should implement the change from DDPS to PSMF by the 17th of May 2025. And you can make the change to the PSMF without the need to submit any variations at this stage. MAHs wishing to do so should inform the VMD at the email address listed here and submit their PSMF summary. The full PSMF should be available on request, which will generally be at the time of inspection. Any MAH who has already submitted a PSMF summary to the VMD should ensure that it does contain a statement confirming that the qualified person has necessary means to fulfil the tasks and responsibilities required by the applicable GB legislation. If the current PSMF summary does not contain this statement, then it should be resubmitted with the amended statement included. And these again can be submitted using the notification procedure as described. Any change from the DDPS to the PSMF submitted after the 17th of May 2025 will need to be made using the VMR category C6. Okay, so I know a lot of you will already know this information and have already changed to your PSMF for the EU, but for those UK MAHs, we just have a little information on the content of the documentation. So the summary of the PSMF, which should be submitted to the VMD, should contain the following information. It should have the PSMF reference number, the PSMF location, the name, contact details and place of operation of the QPPV. As already mentioned, it should contain a signed statement from the MAH and the QPPV confirming that the qualified person has the necessary means to fulfil the tasks and responsibilities required by the applicable GB legislation. And it should also contain some information on the type of record management system used for adverse event reports, and including the name of that database if it's applicable. The full PSMF itself does not need to be submitted to the VMD except on request, and this should be split into a number of parts. The sections in the main part of the PSMF should contain information that is fundamental for the description of the pharmacovigilance system. Section A will have information on the PSMF. Section B, information on the QPPV, the assisting veterinary surgeon and the backup procedure. Section C will contain MAH information. Section D should contain any information on the document management system, and this will include information on the databases used for adverse event reporting. Section E should contain information on the quality management system used for your pharmacovigilance activities, and Section F should contain any contractual arrangements between the MAH and third parties concerning your pharmacovigilance activities. The PSMF then also has a number of annexes associated with it, and this should include any supplementary information that may change frequently. So here we have Annex 1, which is the logbook, Annex 2, which has additional information on the QPPV, including CVs and tasks and responsibilities and any delegated activities. Annex 3 contains a list of products, local representative information where applicable, and a list of pharmacovigilance sites. Annex 4 would contain a list of your written procedures as applicable to your PV activities, a list of scheduled and completed audits, information on KPIs, training, and any risk management measures. Annex 5 will contain a list of outsourced tasks, including a list of any contracts or agreements with third parties. We have maintained Annex 6, which contains any UK-specific information that does not fall in the body of your PSMF. We are continuing to recognise your EU PSMFs, and if there is any specific GB information or UK information that is not contained in your EU PSMF, then this should be included in Annex 6 of ours. And that's it from me. Thank you.